Understanding and managing ADHD in children. Understanding and managing ADHD in children. Attention deficit/hyperactivity disorder, ADHD, is a neurodevelopmental disorder that affects children and often continues into adulthood. It is characterized by persistent patterns of inattention, impulsivity, and hyperactivity that can significantly impact a child's daily life, academic performance, and social interactions. Understanding and effectively managing ADHD is crucial to support children in reaching their full potential. This article aims to provide insight into the nature of ADHD, its causes, diagnosis, and strategies for managing this condition in children. ADHD is a complex disorder with multiple contributing factors. Researchers have identified a genetic component, as ADHD tends to run in families. However, it is also influenced by environmental factors, such as prenatal exposure to tobacco smoke, alcohol or drugs, premature birth, low birth weight, and early childhood lead exposure. Brain imaging studies have shown differences in the brains of individuals with ADHD, particularly in the regions responsible for attention, executive functions, and impulse control. Diagnosing ADHD can be challenging, as there is no definitive medical test. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, DSM-5, provides diagnostic criteria for ADHD, including specific symptoms and their duration. These symptoms fall into two categories: inattentiveness and hyperactivity/impulsivity. Children with ADHD may have difficulty paying attention, following instructions, staying organized, completing tasks, sitting still, waiting their turn, or controlling impulses. Once a child is diagnosed with ADHD, managing the condition involves a multifaceted approach. It typically includes a combination of behavioral interventions, educational support, and, in some cases, medication. The primary goal of treatment is to help children improve their self-control, focus, and overall functioning. It is important to note that there is no one-size-fits-all approach, and treatment plans should be tailored to meet the individual needs of each child. Behavioral interventions are key components of ADHD management. These interventions focus on teaching children skills to improve their self-regulation, attention, and organization. Parent training is an integral part of behavioral interventions, as parents play a crucial role in implementing strategies at home. Techniques such as setting clear expectations, providing structure and routine, breaking tasks into smaller steps, and using positive reinforcement can be highly effective in managing ADHD symptoms. Additionally, teachers can implement strategies like providing visual aids, clear instructions, and frequent rewards to support children with ADHD in the classroom. Educational support is essential for children with ADHD to succeed academically. This may involve creating an individualized education plan, IEP, in collaboration with the school, which outlines specific accommodations and modifications to meet the child's unique needs. Examples of accommodations may include extended time for assignments, preferential seating, or the use of assistive technology. In some cases, medication may be recommended as part of the treatment plan for managing ADHD. Stimulant medications, such as methylphenidate and amphetamines, are commonly prescribed and have been shown to effectively reduce symptoms and improve functioning in many children with ADHD. However, medication is not appropriate for all children and should be carefully considered in consultation with a healthcare professional. Regular monitoring and adjustment of medication dosage is necessary to ensure optimal benefits and minimize side effects. In addition to these core interventions, there are several other strategies that can support children with ADHD. Engaging children in activities they enjoy, such as sports or hobbies, can help channel their excess energy positively and build self-confidence. It is essential for parents and caregivers to educate themselves about ADHD to better understand their child's needs and advocate for appropriate support. There are numerous reliable resources available, including websites, books, support groups, and professional organizations specializing in ADHD. Providing emotional support, encouraging open communication, and fostering a positive mindset are also crucial in helping children with ADHD navigate their challenges and build resilience. ADHD is a neurodevelopmental disorder that affects children and can continue into adulthood. It is characterized by patterns of inattention, impulsivity, and hyperactivity that can significantly impact daily life, academic performance, and social interactions. ADHD has multiple contributing factors, including genetics and environmental influences. Diagnosing ADHD involves a comprehensive evaluation process, as there is no definitive medical test. Treatment for ADHD typically involves a multifaceted approach, including behavioral interventions, educational support, and, in some cases, medication. Behavioral interventions are crucial for managing ADHD symptoms. These interventions teach children skills to improve self-regulation, attention, and organization. Parent training plays an essential role in implementing strategies at home, while teachers can use visual aids, clear instructions, and rewards in the classroom. Educational support involves creating an individualized education plan, IEP, to accommodate the child's specific needs. Examples include extended time for assignments and structured learning environments. Medication may be recommended in some cases, though it should be carefully considered and monitored. In addition to core interventions, creating a supportive and understanding environment is important. Regular physical exercise, healthy sleep habits, and minimizing electronic distractions can all support children with ADHD. Engaging in activities they enjoy, such as sports or hobbies, can help channel their energy positively. Parents and caregivers should educate themselves about ADHD and seek reliable resources for support. Providing emotional support, open communication, and fostering a positive mindset are also crucial for helping children with ADHD navigate their challenges. ADHD is a neurodevelopmental disorder that affects children and can continue into adulthood. It is characterized by patterns of inattention, impulsivity, and hyperactivity that can significantly impact daily life, academic performance, and social interactions. ADHD has multiple contributing factors, including genetics and environmental influences. Diagnosing ADHD involves a comprehensive evaluation process, as there is no definitive medical test. Treatment for ADHD typically involves a multifaceted approach, including behavioral interventions, educational support, and, in some cases, medication. Behavioral interventions are crucial for managing ADHD symptoms. These interventions teach children skills to improve self-regulation, attention, and organization. Parent training plays an essential role in implementing strategies at home, while teachers can use visual aids, clear instructions, and rewards in the classroom. Educational support involves creating an individualized education plan, IEP, to accommodate the child's specific needs.